Hi, this is Paul Swider. I want to take just a quick minute to give you an overview of RealActivity and what we do. And I thought the best way to do that would be just to walk you quickly through our website. The first thing to know is that we consider ourselves to be differentiated, meaning we actually focus on governance and compliance on the provider side, but also on the patient side. Our audience are large academic medical centers and hospital systems in the US, but also abroad as well. So essentially on the provider side, this is the work that we've built with the large academic medical center over the past 10 years. Essentially what we've been able to do is track every single activity, not just research activities, but teaching, GME, administration, essentially any role that the provider plays. And then what we do is what's left over is the clinical time. It's effectively the bottom line for the hospital, the maximum amount that their physicians can bill. So that's on the provider side. And then on the patient side, we focus on governed patient agents. So open foundation, hospital grade. Our premise here is that patient agents are here. The patients are going to have their own patient agents. Hospitals will have their own. Maybe they'll have a secured version of the patient agent they offer to all of their patients in the system, and then obviously patients will have their own. And then we can also see internal use cases, for example, spinning up a fleet of agents, one per patient, and then doing adversarial sort of testing against the Epic record, right? And we're doing some amazing work in that space. And so again, provider, patient, and then and Tula is open source, so you've probably seen Tula stuff online. That's our open source base. That's basically the OpenClaw framework that Microsoft has secured for the enterprise. And then finally, we do have advisory services. So we'll work with we're usually pretty selective, but we will work with some Microsoft partners in helping build product. And then we also help academic medical centers and large hospital systems with Microsoft and Anthropic services. So we're a Microsoft partner, and we're also part of the Anthropic partner channel as well. So that's a little bit about RealActivity. Again, I know we've been posting a lot, and you see a lot of us at events, etc. And I just wanted to take a minute and give you a quick recap of who we are. Thank you.